Hey everyone, let's talk about something that affects millions of people, anxiety. It's totally normal to feel anxious sometimes. Like, before a big game or a first date, those butterflies in your stomach? Totally normal. But when those feelings stick around too long or get in the way of you living your best life, it might be something more. We're talking about anxiety disorders. They're the most common mental illness in the United States, and they're nothing to be ashamed of. Anxiety disorders can look different for everyone. Some people feel constantly on edge, while others have sudden, intense waves of fear. And guess what? It's treatable. So let's break down some of the different types of anxiety disorders. Knowledge is power, people. And remember, if you or someone you know is struggling, you're not alone. There's help out there. First up, we've got generalized anxiety disorder, or JAD for short. Imagine this. You're constantly worried about everyday things. Work, money, family, health, you name it, you're stressing over it. It's like your brain is stuck on overdrive and you just can't seem to shut it off. You might feel restless, on edge, and have trouble concentrating. For example, let's say you're at work and your boss asks you to lead a project. Someone with GAD might immediately jump to the worst-case scenario, thinking they'll mess it up or their coworkers won't take them seriously. These worries can be exhausting and even physically draining. Remember, it's more than just everyday stress. It's persistent and can really interfere with your life. But hey, the good news is that JAD is treatable. With therapy, medication, or a combination of both, you can learn to manage those worries and get back to living your life. Next, let's talk about panic disorder. This one's all about those sudden, intense waves of fear, like a tidal wave of, oh my gosh, what's happening? These are called panic attacks, and they can be really scary. Imagine this, you're just going about your day when suddenly you feel your heart racing, you're sweating, and you might even feel like you can't breathe. It can feel like you're having a heart attack or even losing your mind. People with panic disorder might also develop a fear of having another attack, which can lead to avoiding certain places or situations. Think about it like this. You're at the mall and you have a panic attack. It's super crowded and noisy, and you feel trapped. The next time you're invited to go shopping, you might find yourself making excuses because you're terrified of having another attack. But listen, panic disorder is not your fault. It's a real medical condition, and with the right treatment, you can learn to manage those panic attacks and regain control of your life. You got this! Section 4. Social anxiety, phobias, and agoraphobia, navigating fears. Let's dive into types of anxiety disorders revolving around specific fears. First, social anxiety disorder, fear of social situations, worry about being judged or humiliated. It's like a spotlight on you, making you self-conscious. Next, phobias, intense fears of specific objects or situations. Spiders, heights, flying, there's a phobia for it. Finally, agoraphobia, fear of situations where escape might be difficult, avoiding public transportation, crowds, or even leaving home. Section 5. Separation anxiety, beyond childhood. You know how some kids freak out when their parents leave them with a babysitter? That's separation anxiety, and guess what? Adults can have it too. It's totally normal to miss your loved ones when you're apart, but for someone with separation anxiety, that worry turns into extreme distress. They might have a hard time sleeping alone, be clingy, or constantly call and text to make sure their loved one is okay. Imagine this. You're going on a business trip for a few days. Someone with separation anxiety might worry excessively about something bad happening to their loved one while they're gone. They might even have physical symptoms like headaches or stomach aches. The good news is, just like other anxiety disorders, separation anxiety is treatable. With therapy and support, people can learn to manage their worries and live their lives to the fullest. Section 6. OCD, PTSD, and seeking help, managing complex reactions. Let's talk about two more types of anxiety disorders. First up, obsessive-compulsive disorder, or OCD. This involves unwanted thoughts, obsessions, and repetitive behaviors, compulsions. Imagine you can't stop thinking about germs. You wash your hands over and over. Next, post-traumatic stress disorder, or PTSD. This can develop after a traumatic event. People with PTSD might have flashbacks and intense anxiety. Anxiety disorders are real and treatable. Reach out for help. There are amazing therapists and support groups. Be kind to yourself. You've got this. Thank you for watching. Please subscribe to this channel, like and share this video. We are here to help you heal.